by helping to move the needle on these non-MTM bigger view programs is creating a bonus pool and a dollar amount that will be placed in front of pharmacies in 2025 that most pharmacies just haven't seen yet. So obviously it may not be pharmacy A, pharmacy B, but broadly across the marketplace, we're seeing some value-based care agreements and bonus pools hit some true bonus-only dollar amounts that we've just never seen before. And that's in stark contrast to potentially what may be out there for CMRs or reimbursement on other MTM-related items.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. Welcome to the PQS podcast, where we focus on medication use, quality improvement, and how we can utilize pharmacists to improve patient health outcomes. I'm your host, Nick Dorich. On today's show, we have a special and returning guest. It's my colleague here at PQS by Innovaccer, Todd Sega. Todd is the Managing Director of Pharmacy here at PQS by Innovaccer. Todd, welcome back to the show. How are you doing today?
Doing great. Excited to be back to cap off 2024.
Yeah, this year has gone by incredibly fast, and it's been a really exciting year for us at PQS by Innovaccer, a really exciting year for pharmacies around engagement and moving towards more value-based care opportunities, which, folks, that's what we're going to be talking about today for this episode. I brought Todd on, and we're going to be covering this really exciting topic about how we continue to move pharmacy forward into value-based care. But Todd, before we get to that, let's get a quick introduction or reintroduction, because some folks, if they haven't listened or checked out the show before, they might not know who you are. So do you mind giving us a quick introduction, on who you are and what you do here at PQS by Innovaccer?
Yeah, sure. Happy to do so. So excited to be back. Thanks for listening in. So I am a pharmacist by background and spent my earlier part of the career working in community pharmacy. And that's where I developed most of my passions in pharmacy and helping to create change, also likely because of a lot of involvement in state associations, whether that was with the National Association of Chain Drugstores, where I know our paths first crossed, Nick, as well as the Ohio Pharmacists Association, where I just had some absolute great mentors who were in the association world, but also some independent owners that I was able to connect with and learn from, and loved being a part of the movers and the shakers, and developed a passion to try and connect payers to pharmacies to create more change and opportunities that would come to community pharmacy. So that's when I had a career path that took me back into association management. And from there, saw this awesome opportunity to bring pharmacy into value-based care. And there was a company just launching at the time, which was PQS, and made the leap to come over and have really enjoyed the last 10 years growing and learning at PQS and helping to bring change to the marketplace. And so today I'm the managing director, as you mentioned. So I oversee our pharmacy business unit at Innovaccer, working with some of our other business units and other verticals now that we're a part of a larger company.
Fantastic, Todd. And yeah, great to have you here for this episode. And let's get into our conversation, our discussion for today. I mentioned it earlier, right off the cuff from as we started this show. We're going to be talking about value-based care and how we can catapult pharmacy, the pharmacy community, pharmacy practice into that world. Now, there are parts of pharmacy practice that, Todd, you and I know, and for our listening audience, there are parts and there have been aspects of pharmacy that are involved with value-based care, but really most of the healthcare world, at least here in the United States, is looking to move towards a more expansive value-based care. So as we want to get pharmacists and pharmacy paid like other providers, guess what that means, folks? It means we're going to have to adapt. It means we're going to have to work through value-based care. And just broadly for us, or taking a quick time out, let's define value-based care. Value-based care, it's a healthcare model focusing on quality of care, patient experience, and provider performance. This is all done with the goal to improve health outcomes while also reducing costs. So the idea here is a better patient experience, a better patient outcome. It's reducing really the number of services that a patient needs to get or to receive, but at the same time improving the health outcomes. So with that, there's a lot of changes that need to occur, a lot of synergies that need to be exercised, and a lot of work that we still need to do to get to that place where the pharmacy as a location, but the pharmacist and the pharmacy team members are a part of that active value-based care team. So Todd, we've gone through a bit of an exercise, and you've done a lot of the legwork on this one, admittedly, to get through and identify what are going to be some of the most impactful changes that need to occur to facilitate pharmacy involvement in value-based care. And I'll preface this by saying some of these are items that internally in the community pharmacy or in the pharmacy community, internally for us, some of these need to happen. Some of these have to be changes that happen inside the pharmacy. Some of them are going to be changes that health plans and payers need to engage with to help facilitate this. And then there's going to be some kind of third bucket that will be other aspects, whether it's vendors or regulatory changes that help facilitate this. So, Todd, you've identified some areas that need to be that where there's going to be changes to help facilitate this change. Let's go through, and can you outline, what those 5 items are to get us started? Everybody can kind of take their notes to get an idea of what's coming ahead, and then we'll deep dive a little bit into each of those topics. So I'll hand it off to you here. What have you identified?
Yeah, thanks, Nick. So for those 5 areas, obviously there could be more, but at least the top 5 that we're looking at in our crystal ball, we believe that 2025 is going to have some of the highest increases in non-dispensing revenue opportunities that the marketplace is seeing. We also see a lot more scrutiny and evaluation on the results of programs that payers may take with pharmacies in that value-based care arena. And then we also see some marketplace changes, to your internal and external point, in Medicare Part D, with some changes and consolidation, exits in the marketplace that are going to have an impact. And then we also see this as one individual can't win it. So those who are able to think about delegation of tasks as a key win for value-based care. And then finally, workflow solutions are going to win in 2025 or beyond. If you can't get into the workflow and the pharmacy can't operationalize it in their workflow for a value-based care program, it's really increasing the gradient of that slope for the pharmacy to be successful in those programs. So those are kind of the big 5 areas, and would love to dive into some of those in a little bit more detail with you.
Absolutely. So we're going to start there, and this is, these are five items. As you said, Todd, there are more considerations, but these are the 5 aspects, and it's not necessarily number 1 to 5 in terms of the most important, but these are all 5 things that need to be occurring somewhat simultaneously, or are going to be occurring simultaneously in 2025.
Right.
So, Todd, with that, the first item that you've identified, increased non-dispensing revenue opportunities for pharmacies. And I'll cut right to the chase on this. This is something that the pharmacy community has been asking for years, if not decades, right? And I think a lot of the conversation on this topic has existed around, the chicken and the egg scenario, where if these opportunities are available, pharmacies will start to engage with them. I think what we're pointing to here is that, hey, these opportunities are existing for 2025. It's no more chicken and the egg, it's happening. And pharmacies, this is really a time to engage and to maximize the opportunities that are going to be there. So, Todd, I'll let you kind of expand upon this and get into some of the nitty-gritty details that are going into the background as to why this is occurring now in 2025.
Yeah, sure. So on the payer side, it's unsurprising, typical for most businesses, you're trying to make the most efficient use of resources. So for those who have investments that they want to make, they want to know what those returns are. And we have seen a pretty big decrease in the star ratings for payers for the 2025 star ratings, obviously reflective of data from 2023. But still, the decrease that we've seen has had payers pick their head up a little bit and say, we need to either do more with the channels that we have, or we need to open up other channels for improvement initiatives. And this goes way back to a study that CMS did probably 6-7 years ago, but they looked at how many quality improvement initiatives a health plan sponsor typically had, and the sweet spot was 11. So it can't just be a provider-led strategy. It can't just be an internal outbound call center approach from the payer. It can't just be mailers. It can't just be care coordinators at the plan, but it really needs to have multiple layers to it. And that's where pharmacy and the touch points that pharmacies have represent an absolute channel to impact the member. So when you think about this one side of the payers who's saying, well, our scores have dropped, we have this investment part where maybe they don't want to be completely a five. If you end at a five, that's great. But some may say you've overspent a bit if you didn't need to get to a total 5-star level. But you also don't want to be below 4-star, since 4-star is the cutoff for payers to get the quality bonus payment. So for those that are down, so for 4-star and above, the percent of membership that's in a 4-star above contract is down 12% from the prior year. So you may say it's only 12%, but 12% across, tens of millions of lives is a pretty good number. And that bonus payment multiplied per member per month, it has a pretty big impact. So that's a driver. And we also see even the 5-star contracts, there are very few standalone 5-star contracts at this point. So now that's down to almost 7. So since that's a single digit, you have less of those players in that space, but yet you have a demand for more of these quality improvement initiatives to take place because they're needing to increase their scores from where they were before. So that's sort of one point related to it. And then the other is another regulatory change with the star ratings. Obviously, we know the CMR completion rate has shifted from a star to a display measure for a couple of years while it goes some retooling and some updated specifications due to updated eligibility criteria, which I know will expand that pool. But I think that the drop in some of the ratings are helping to drive a broader thinking along with the absence of CMR. MTM just isn't necessarily a top of mind service or action items. So it's really more about what are the services that pharmacies can perform that can impact quality, add value, and enrich the member experience. So I think those two things combined are spooling up a bit more demand for payers to say, what can our programs look like? They're not going to be necessarily MTM programs, but how can we be unique, more creative about the types of programs and offering different programs that we've never seen before, even related to formulary. So impacting the drug spend component of this, how do pharmacies become a more active participant in ensuring formulary compliance, medication affordability and access, and a partner, not just working against a payer saying, hey, your health plan has a PA. Won't require that. But how do we actually bring those two together? And we're seeing payers start to think like that. And as a result, the value that can be unlocked by helping to move the needle on these non-MTM bigger view programs is creating a bonus pool and a dollar amount that will be placed in front of pharmacies in 2025 that most pharmacies just haven't seen yet. So obviously it may not be pharmacy A, pharmacy B, but broadly across the marketplace, we're seeing some value-based care agreements and bonus pools hit some true bonus only dollar amounts that we've just never seen before. And that's in stark contrast to potentially what may be out there for CMRs or reimbursement on other MTM related items. So, we're excited for that. And we think that's going to be one of the biggest drivers because we know pharmacies are looking in the corner for how do I diversify my business and where am I going to get some non-dispensing revenue? So that's kind of driver number one for 2025.
Yeah. And Todd, I'm going to kind of just segue us right to driver number 2 for 2025. And it's going to be about that payer pharmacy relationship and that sort of engagement that exists. It is the sort of item where each health plan has, actually, I'm even taking a step back, right? Each patient in each state, each region has their own different and specific needs. The health plan, the health plans that are out there based upon the members or patients that they are serving, they're going to have different performance trends, and that's going to influence why and what services they want to incentivize, and working with both the providers and those pharmacies and network for them, because hey, everybody's going to be a little bit different. That means for pharmacy that to engage with these programs, you have to be a little flexible. You have to be able to be a little bit reactive because how one payer may be supporting a program or incentivizing services that may be different from the next payer, the next health plan that you've got down the street. So, Todd, this second item, I think you had it identified really as the pharmacy payer, partnership and really delivering on these services. So, what do you mean by that? And let's expand upon that topic.
Sure. The segue I used to describe this with the expression to whom much is given, much is expected. So with point one, more is being given to these dollar pools for pharmacies. So what's expected? Well, there will be some documentation. Is it going to be dollar for your minute for the time you spent documenting? Maybe, maybe not, but that's sort of the value-based care arena where you're moving from fee for service, watching the clock for every single minute. But hey, if I do X and my payment is Y, do I think that can be worth it across my population? And that's the shift in mindset from the pharmacy to think about that fee for service to participating in a performance-based or value-based care program. So we definitely see a lot more scrutiny by plans to say, I really want to know what is it that that pharmacy is doing. It doesn't need to be some proprietary, confidential, secret sauce that the pharmacy may have, but just what are you doing? Can I know for my member, what type of outreach did you do? Were you successful? Were you not successful? We want to know when you weren't successful as well. So having a little bit more expectation on the documentation requirements is definitely becoming a minimum threshold. And payers are very interested to say, well, who is willing to do that documentation and who's engaged? Because our prior strategy of just broadly throwing out across the entire network, here's a program, let's see who does what with it, is changing. So this increased scrutiny that I mentioned is shifting now to, hey, we may see more of a reemergence in high performing networks or high engaged networks. We definitely see a little bit of a shift in the term of CMS's term of preferred cost sharing pharmacies. That's not what we're talking about here. We're talking about who should be in the network for an enhanced service, who's truly going to say, I understand the program and I either don't have the resources or capability to do it, so I'm going to sit out. Don't say yes if you're not going to have the ability to engage in the program. But for those who say, I am going to step up, we would love to see it. And the plans are wanting to see someone step up to do it. And they're very willing to say, even if that shrinks the network down to a smaller percentage, we'd like to engage with the pharmacies who are really wanting to engage and interact with our programs, help us change some of our programs. And there will be dollars that will be there on the other side of it, as we're seeing with these increased amounts. So that's sort of what I meant by that. And we're definitely seeing a lot more interest there from payers to have evidence of the engagement to know who's truly engaging or not and separating those from each other.
I think of it, Todd, this is just a very, very simple and straightforward thought process that go to it. In a lot of ways, to me, it's kind of like Master Yoda from Star Wars. Do or do not. There is no try. It's really that part, right? As it goes to these sorts of programs, can you produce the results and outcomes? Because the payers do have specific goals to achieve. And it's a part there where if you're not able to help achieve those quality goals, then you actually may be hurting those quality goals here. So that part of it's going to be really important to, if you're going to engage, make sure that you can engage and commit around these services. I think pharmacies can and are showing that they can do it. But just like I mentioned from the start, health plans are going to have different patient populations and different ways that they operate. Pharmacies are in different stages of readiness and education and training and outreach. So there's a part there where there's going to be some maturation, I think, for some pharmacy groups, some more than others, to be able to address that. Todd, beyond this, and you've already addressed some of these items around market changes. You talked about some of the changes around MTM, CMR, but 2025 for Medicare is going to be really kind of a seismic shift, more so than what we've seen or what the Medicare market has seen in a number of years. As we've talked about this with some of our pharmacy partners, in Medicare open enrollment, there's not really seen as much of a change. But what we know in speaking with our health plan partners is that this is one of the most drastic changes they've had year over year, really in the 20 plus years since Medicare Part D has come around to fruition. So can you explain, what some of this is going to lead to, and how this is impacting members or the patients when it comes to their interaction with the health plan that they are utilizing, and how this could have an impact as well on the pharmacy where they are where they're receiving, their medications.
Yeah, this is one where it's not necessarily, to your point, the internal action needed by the pharmacy. It's an indirect effect that will impact pharmacy, and it is more of an exogenous shock or impact to the Med D space. And we could honestly spend more than an entire podcast going over all of the regulatory changes occurring for that marketplace. I'm just gonna highlight one for right here, but a lot of the implications of the Inflation Reduction Act coming into play for 2025 is definitely causing the players in the market to behave in what most would say a rational way because reimbursement challenges are there. They have a little less flexibility and levers that they had because of some of the constraints and then the cost setting by CMS on top drugs. But essentially, we've had a lot of players leave the market more so than we've seen in prior years. And so these health plans that are terminating their Medicare or have terminated their Medicare contract for 2025, that's going to displace about 1.4 to 1.5 million Medicare Advantage lives. And when you take that across the entire US population, you can see how that just gets absorbed and it naturally falls out. But where these plans are going out of market isn't necessarily going to be evenly distributed across the board. So it may have more of an impact in these pockets of the country where there wasn't as much competition, or let's say a pharmacy had more market share of this Medicare Advantage player that's now left the market. That's going to change the business dynamic, especially if it's under a different PBM contract, if it's a pharmacy that's accepting that. So those are the things that will cause a little bit more uncertainty on the reimbursement for the drugs themselves, because we already know we had this big shock coming from 2023 to 2024 with DIR change and now needing to know that lowest cost possible. It really accelerated the bottom floor of that reimbursement, coupled with the carryover from 2023's retrospective DIR payments. So that created this Q1, Q2 cash flow crunch in 24. But now you have at least more stability with a lower reimbursement number, which isn't great. But now you just added a little bit more instability potentially in certain markets because you're going to have these changes. You're going to have different formulary switches because they've now gone over to a completely different plan. And you may have member experiences that are going to change with the members as well, since they're interacting with a totally different plan than what they had before. So all of these things may result in a little bit more troubleshooting on 1/1 in January for pharmacies to help people process this new insurance, or recognize that they need to educate the member a little bit more about you didn't just switch from plan A to B, but plan B also has a slightly different benefit profile. It may not have the same amount of supplemental insurance benefits as well. So a lot of those changes are typically rear their head at the pharmacy. I know when I was working there, you end up having to explain how insurance works and what the donut hole was, and that's shrinking. So that will help in some respects. But the pharmacies tend to be frontline when insurance doesn't work, and all of these changes could likely create some secondary impact in the marketplace.
Yeah, it's a sort of, and we've covered this part, right? There's a lot of aspects of it which may not be specifically touching the pharmacy staff or how they're working, but it does impact the patients. And ultimately, the pharmacy we know is the most common place where a patient is seeing a healthcare provider, having conversations about their medical care or even just their benefits that relate to it. So this is an item where I would expect that there's going to be a lot of questions here for pharmacy staff personnel in 2025. But Todd, we're going to transition to the fourth item that you highlighted, and this is something that we're going from an item that not really a whole lot that's specific to the pharmacy to an item that is going to be, I would say, almost completely controlled by the pharmacy staff and by the pharmacy personnel. And for that item, I am talking about the delegation of tasks and really just kind of the pharmacy working experience. So this is an item where we have seen in recent years and a long running progression where pharmacy staff, pharmacy technicians are able to do more services. And we're also seeing state regulation changes where pharmacists are able to provide more services. So pharmacists can do more, pharmacy technicians can do more, but being able to do more, if it's not done efficiently, isn't necessarily helpful for us behind the counter or for the patient. So, what were your thoughts on this topic, and, what pharmacy needs to look at, what pharmacy needs to do to evolve for 2025?
Yeah, it certainly takes a team to win. And we've heard that anecdotally from pharmacies where we check in and we see that they're just engaging and highly successful in some of our clinical and enhanced service programs. And when you profile that pharmacy, you find that it isn't just Jane Smith or John Doe, the pharmacist, who says, "Hey, I print this out, I have a chase list, I'm on it, we're doing bag tags, and we call our patients, we're highly engaged in it." But it's really where someone has said, "Oh, yes, I check to see how we're doing, but I delegate that to our stars or quality champion in the pharmacy." Having a champion that is secondary to whomever the main equip user was, or if it's not the pharmacist in charge or the pharmacy manager, but the equip user is the quality champion and it happens to be the lead pharmacy technician. That's a great example of helping to delegate. And we see groups that have printed out different scores, their goals of where they want to be in terms of helping to shift the needle from non-dispensing opportunities to non-dispensing revenue. And these folks will then print out where they are and where they want to be, and then they will post that somewhere in the pharmacy. And I think that's relatively well understood that when you measure something, people kind of flock to that. So measure what matters. And if this is a goal for the pharmacy, then we're helping to showcase what are the dollar opportunities that are available that I talked about in the first step. But let more than one person help win for the team and make sure that the entire team is aware of what that goal is and chasing towards it. So those are just some common best practices. And then we find out, in our new world, as we get the chance to now interact a bit more with ACOs and risk-bearing entities on the provider side, it's far more distributed. And obviously there's a lot more resources typically at the ACO, where there are large care coordination teams working with the providers, but they make goals very available to a lot of the decision makers in the provider groups, and they're constantly updating and refreshing those so that everybody knows where people stand. But additionally, what role and what are the expectations of different staff members to help the entire organization hit that goal? So I would say, in addition to delegation of tasks, it's just making those goals highly visible and informing the entire team so that everybody's bought in, because you're going to win as a team. So that's sort of what I was meaning by those who delegate tasks and make it a shared win for the team.
Yeah, I think it's. I'll expand on that, Todd. I think it's informing and empowering the staff, right? Whether it's the pharmacy
Yep.
technicians, the pharmacist, to work through these activities. It's important. I think most of us that have worked in healthcare, or that do work in healthcare, are doing because we have an interest in helping people, helping patients achieve their health goals, and a lot of these different value based considerations are along those same pathways. So this is really a part here where it's to some extent, hey, how do you help your staff control your own destiny in
Yep.
moving that forward? But Todd, we've covered, this is something that the pharmacy team, the pharmacy personnel can do internally, but there's going to need to be a little help and assistance that goes along with that. And I think this goes into the last item that you identified, which is going to be workflow solutions and capabilities. So obviously, folks like ourselves at PQS by Innovaccer, and for the pharmacy teams themselves, if it's an independent, they're using a dispensing system or a management system for a pharmacy chain, they've got their support from their corporate office, from their clinical offices, et cetera. So there's going to be help where it's not just the pharmacy staff in the physical pharmacy location. There's others that need to be involved. So what are you meaning? What are you indicating by this last item that you've identified?
Yeah, this one I'm probably the most excited for, even though it's hard not to get excited about the number of non-dispensing revenue opportunities that are going to be available to pharmacy in 2025. But this is really built upon not just belief, but actual data from what Innovaccer has found, having worked with providers over the last several years with a very similar product, because they've realized on the ACO side, if the ACOs can't get into their provider workflows, the ACOs are unsuccessful to get their physicians to do what they need to do, to act at the right time, take the right actions from all of this data and predictive analytics to help bend that cost curve for the ACO, unless they're in workflow. And so many of the groups with the docs as well, we'll try to have the slickest portal, the best EMR type integration, but it really needed to be a clickless integration within their workflow to change behavior to see the results. And I believe there was one health system that just reported a couple weeks ago that when they looked at 2024 year to date, they had already calculated a savings of almost $9 million because they were able to get the physicians to act at the right time. And the physician said, thank you, I wasn't buried in my EMR to find what it was that I needed to do and when, because there was a solution that was a really powerful overlay on top of their EMR, which really act as more of a co-pilot to help guide them to superpower the EMR guided by the ACO. So when we look at this and think about the marketplace for pharmacy, we recognize that workflow solutions are going to win. If you can't help pharmacies operationalize what they need to do and when in that workflow, it's just a very, very steep gradient for pharmacies to have to push that boulder up a hill to try and convert non-prescription opportunities to actual revenue to complete those, so that more than just one person going to the team event can actually win for the pharmacy. So with that, I'm excited to share that we will have a new product that will hit the marketplace in 2025, and we will have a lot more information to come. I'd love to get back on the podcast if I can to talk about that product, but we have some folks that are beta testing this particular new product for us right now, actually. And this new product will help us do just that, get into that pharmacy workflow, prevent very high value opportunities to the right people at the right time so that they can be more effective at switching over what exists out there to work on to actually being worked on, and then getting additional revenue that doesn't even need the medical billing component, since we are in Medicare for a lot of the programs where we're unlocking value and we still don't have that provider status. But yet there's still a lot of dollars on the line that can help really make up for potentially lost margins on the prescription drug reimbursement side. So that's where I'd say workflow solutions are going to need to be there. We're really excited to be able to have a product that we believe has really strong product market fit. And we've had some great reactions from our early customers in testing it.
Fantastic update there, Ted. I think this is an item where we preface this by all saying there's going to be changes that are going to be coming. Some are going to be important for pharmacy, but also for some of the groups like ourselves, in reacting and really being responsive to what the customers, the pharmacy users, to be able to maximize these opportunities, and really to be doing it from a standpoint to benefit the patients, the patient care activities that they're really driving forward in 2025. So, Todd, I'm going to summarize things real quick for us and what we addressed today, looking at impactful changes for 2025 that facilitate or expand opportunities for value-based care with pharmacy. So we talked about increasing non-dispensing revenue opportunities. We talked about pharmacy and payer partnerships, about being able to deliver on these enhanced services. We talked about operational changes for Medicare and the multifaceted approach that is going to be occurring for those items. These are going to be items that are going to be kind of payer directed or regulatory directed, government directed, that impact value-based care opportunities for pharmacy. And then when we get into the items that are more pharmacy controlled, that's about delegation of task and maximizing all the members of the pharmacy team. And then finally, workflow solutions and increasing capacity and capabilities to drive this engagement. So there's, Todd, that's a lot of work for 2025. And I don't think that's all necessarily occurring just in 2025, but it's important to keep, our eye on the ball and continue to make changes in our industry, that being the pharmacy industry, specifically the community pharmacy industry, to ensure that we're keeping we're keeping one foot in front of the other, and that we're continuing to show progress on these items. Now, Todd, as we wrap this up here, what do you think for 2025? Is this going to be a good year for community pharmacy? That's a lot of things and change can be painful, But I think I get the sense from you as well that these are all changes that are realistic, that these are changes, and well, some not just realistic, they are going to be happening, but these are going to be positive changes for pharmacy at the same time. So, what are your closing thoughts about what this means for pharmacy?
I consider myself as more of a realist, so not necessarily a pessimist or an optimist, but I would say as I look at 2025, I have to push myself and say, even being a realist, I'm going to notch a little bit up towards the optimism. So I am looking forward to 2025. I know margins are pinched like they've never been before, but instead of these large shocks year over year about what was going on with DAR, it's low, but in terms of the percent change from what we've heard, it's at least stable from the past year. So at least knowing something's not going to be great allows you to plan for it, which means it brings you a little bit more stability in what resources you may try to lock in. And so if you have a good set of fixed costs and great team members that are on board in the pharmacy, stay tuned, look for those non-dispensing opportunities, engage on them. If you do, more opportunities will spin the flywheel and more will come your way. So we can bend this needle and would love to make our biggest outcome measure what percentage of all pharmacy revenues are coming from non-dispensing, and our measure of success, not just here, but across the entire marketplace, will be when we get that number to be large single, double digit, and then cross the 50% mark, when we can say that we're helping to contribute and enable pharmacies to diversify their revenue model. So for that, I'd say we're making a really good step in 2025. We just need to lock arms and move forward so we can win together on that.
Yeah, and Todd, I think that's the important aspect here for it is it's a win together consideration, not just for for ourselves here at PQS, but for the pharmacies, for the health plans, but most ultimately is for the patients and how they are maximizing the care, the benefit that they get in working with their local pharmacist and their pharmacy team. So, Todd, appreciate you coming on to the show again. I think it's a pretty regular, probably annual occurrence that we've got you back on the show. You and Jesse McCullough, probably the two most frequent guests that we've got on the show, and always appreciate these opportunities for us to think ahead, to challenge ourselves in how we continue to push pharmacy forward. And Todd, if there's folks who want to get information about what we're doing at PQS, or hearing as you're sharing new information in 2025, can they find you on LinkedIn? Any other ways that they should look for these updates or get a hold of you?
Yeah, sure. LinkedIn's always an easy way. It may not be as timely as email from time to time, but yeah, LinkedIn's great. And then also reaching out directly on our website and using the support link there will help link me up. But would be happy to meet and chat with anybody, and wish everybody the best, and cheers to 2025.
All right. Todd, thanks for that final message there. We're looking forward to a great year ahead. But for our listeners, for our watchers here of the show, that does mean we are at the end of today's episode, today's conversation. So thank you for joining us on today's episode of the Quality Corner Show. Before we close, we do have one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.